If your thyroid blood test results came back abnormal and you weren't sure what they meant, then this will make it simple. There are only 3 numbers you need to be familiar with, and these numbers need to be read together: TSH, T3, and T4. And here's what they usually mean. High TSH with low T4 usually means hypothyroidism. That usually does require treatment. Low TSH with high T4 usually means hyperthyroidism. That also requires medical assessment and often treatment. If TSH is abnormal, but T4 is normal, we often monitor before treating. If TSH and T4 move in the same direction, both high or both low, that's uncommon in primary thyroid disease and needs specialist assessment. Remember, never interpret TSH alone. It must be read with free T4 and ideally trend over time. TSH stands for thyroid stimulating hormone. It tells us what the brain is asking the thyroid to do. Think of it like a signal. So if your thyroid is underactive, then the brain will increase TSH. And if the thyroid is overactive, then the brain will reduce TSH. In the UK, normal TSH blood test results range between 0.4 and 4.0, but the ranges do slightly vary by labs, so always check your lab's references. T4 typically sits around the 9 to 25 range. T3, you're looking at ranges between 3.1 to 6.8. Again, lab references may vary. If someone is feeling well, overt hyperthyroidism or hypothyroidism on repeat testing usually still warrants treatment just to avoid long-term risk. T3 is the active thyroid hormone, usually tested when we suspect hyperthyroidism. And if T4 is normal and T3 is high, then this is what we call T3 toxicosis. T3 is rarely the first marker we rely on, but it does help clarify overactivity. Now you know how to read your thyroid blood test results properly. Next, we'll move into prevention, because I truly believe the risk markers matter more than symptoms. I'll see you there.